When we see the growth rates, we're still growing, but you will see new winners and new losers depending how they adapt to the new environment and how they're finding their niches to play in this environment. The second one is COVID-19 related, which the crisis serves as a catalyzer for change with a long-lasting effect on healthcare. We see it in Germany, the way the patient flow in hospitals is changing. We see the communication with the physicians changing. They're demanding different kinds of activities. And last but not least, this environment has a different impact on the way of working for business development. What I said applied to the organization obviously applies to business development as well. We will see more partnerships, we will see different partnerships, and we will see other players with a wider ecosystem as well.
In fact, the world didn't stop for us. We enjoyed even more time. Of course, we stopped travel, but we enjoyed more time at home to manage the deals, to contact with clients, to keep the work going on, and signing contracts and so on. So nothing stopped. Of course, there was a lot of focus on the priorities, a lot of focus on supplying the products to our customers, and also a lot of work with our own suppliers from our APIs and excipients in this period.
I think the environment for us from a business development standpoint has not stopped clearly. In fact, the more I see into this, my reflection is that it's only strengthened our position from a business development standpoint. I see a lot more partnerships happening, a lot more willingness to look at assets differently, look at targets differently. I think that's definitely a good news. In terms of the pure signing of deals, whether it's in licensing or acquisitions, I have not seen, my thesis is that the deal pipeline has not necessarily shrunk. There has been a little bit of a sluggish from a time perspective, but I don't see that the deal pipeline in entirety has slowed down.
If you're looking into the COVID-19, I think COVID-19 is, for me, it's like a catalyst of these previous evolutions that you see, so change to hospital range market, to a specialized market, and a more non-branded generics. We experienced it, for example, in the portfolio. What we are seeing, and what also my previous colleague are reporting, is that the acute product portfolio has decreased dramatically due to the lockdown of pharmacies and the absence of physicians or patients. But on the other hand, you see that the chronic diseases and hospital range is growing, is steady growing. So really, we see this once again as a catalyst. That means we have to strengthen our portfolio and have to shift to hospital range areas. And the other area that is also important in terms of strategic positioning, we have to be more international. We have to re-strengthen our international footprints. It's not good to depend only from one country, and it's pretty difficult to get innovation into smaller countries if you're not have a broader geographic footprint.
Even more important in these days to have a really nimble reaction, a very high speed of response to opportunities that are coming up. And speed of response is not how quickly you respond to an email. Speed of response is how quickly you respond to an opportunity or you respond to an issue. It's driven by how bureaucratic your organization is or how not bureaucratic it is. And this is not something that we can, tell our people, okay, now from today onwards, we are going to respond to all opportunities within X number of hours. It never works that way, because this is really a cultural thing. And if we've all established the culture, if we've established a culture within an organization of a particular level of nimbleness, that is, fortunately or unfortunately, the speed at which organizations will respond. So if you want to change your speed of your response of your organization to an epidemic, you need to also look into how quickly you can change your culture.